agenda. We've got a presentation next, the Care Pathway Framework Briefing by the Institute for Innovation and Implementation, and they're from the University of Maryland School of Social Work. So just some background, this presentation is being brought to you by the new Service Array Committee, the new Standing Committee of SIAC. And just so you know the aims of that Standing Committee, to kind of bring everybody together on that. So there are 5 things that that Standing Committee is focused on. The first is to mapping our existing work groups that focus on service array, and then use our service array standing committee as a hub to support coordination of what's going on, communication and alignment among the different efforts, because there's a lot of things going on. The second aim is to revisit, refine, and revise our ideal service array document that was developed in 2017. So you may remember that document. The third aim is to assess the current service array that's available and accessible in Kentucky to our children and our transition age youth and their families. We want to identify and prioritize our service gaps that need to be addressed, and then propose and implement solutions to those gaps, to address those gaps. So those are our aims of that team. So while our overall work is grounded in the system of care philosophical framework, we thought it would prove helpful to have another framework to guide our specific efforts. We're wanting, of course, to improve our service delivery system here in Kentucky, and so sought out the assistance of the Institute of Innovation and Implementation at the University of Maryland. So we believe the Care Pathway presentation today will benefit all of SIAC, as well as the Standing Committee members. So regardless of whether your work focuses on the system, the program, or the individual level, it's going to serve as a guiding framework for our collective efforts. And of course, we're looking to expand and improve our service delivery for children and transition age youth and their families. So without further ado, I want to introduce Kimberly Estep and Susan Sulzbach.
Denise Sulzbach.
I'm Denise. I love the name Susan now.
I know.
I don't know where I got Susan from. Denise.
That's okay, Ivy.
No problem.
Thank you. And that background and aims of the service array work group is very helpful for this presentation. So,
thank you. I'm going to share my screen, and so hopefully in this age of virtual, our virtual world, are you all looking at the slide? Great. Thank you so much. I am Kim Estep, and I'm gonna talk a little bit first, and then Denise is gonna talk, but I am the director for implementation and workforce development at the Institute. I'm also the director for the National Wraparound Implementation Center, and so some of you I may have interacted with in various roles that I play, and we've been fortunate enough to have a longstanding partnership with the state of Kentucky. And so we're very excited at the work that's going on, and we're very happy to be partnering with you all in this effort, and any help or assistance that we can provide, we would be happy to do so. Today, of course, ask questions and then following the meeting as well. Denise, did you want to go ahead and introduce yourself so that we can?
Sure. So I'm Denise Sulzbach. I'm the director of the National Center at the Institute. I've worked with Tina and Beth for years now. We operated SAMHSA's National Technical Assistance Center for System of Care grantees for 7 years, from 2013 to 2020. And since that time, a lot of states have contracted back with us, in addition to our NWIC states, National Wraparound Implementation Center states. So I continue to work with many states across the country. And I heard a lot of judiciary and juvenile justice folks on the phone. My background is I am a prosecutor. I was a prosecutor, and I was also a former deputy secretary of the Department of Juvenile Services. And seeing how our systems build our children from that lens is how I actually got into this work. So thank you for having us today.
Great. And so just to kick off a little bit, I think when we talk about implementation science and care pathways, it's like, why does all of this stuff matter? And so hopefully as we walk through today, we are going to go through fairly quickly, and want to make sure that we leave time for questions and any thoughts or comments that might come up as we're talking. But it's really a way to operationalize that system of care framework and to take those values and principles and cull it down into something that we can walk away and say, okay, what do we actually need to do? Because sometimes that's hard. And so as we walk through today, we're going to talk about the use of implementation science and care pathways to support service array design and implementation. This theoretical model and these tools can also apply to other elements of your system at various levels. And so as we walk through, you're going to see some of that today. We're going to share a 5-step strategy for care pathway planning. And then, of course, as I said already, answer any questions that you might have and so on. And so for families, we know that accessing help can sometimes be a little complicated and sometimes messy. And oftentimes, the more complex the need, the harder it is to navigate. And so what we're hoping with all of this and all of the fantastic work that you all are doing is that we can actually clear a path and we can make sure that the help that we're providing, the help that we're ensuring is available for families in the state of Kentucky is helpful. I mean, imagine that, this concept of help being helpful. And that's really what it's all about, is how do families get what they want, when they want, how they want, and so on. And is it meaningful and actually helpful in their life? So to talk about that, we're going to set the stage and just do a brief, like very, very brief and hopefully simplistic kind of explanation of implementation science and this process of implementation. And so I think many times implementation, we think of that as implementing a practice or implementing something that's related to the families that we partner with. But we can actually apply those implementation science concepts to the work that we do as systems. And so when we're going through some sort of reform effort, the first thing that we want to do is identify the need. And I think sometimes we have qualitative information. We have, that phone call from a panicked worker, a panicked leader, a division director, a family that's like, well, I wish we had this. And so we have all of this kind of anecdotal qualitative information coming at us. But we want to know as a state, as we're building out our service array and as we're walking through these reform efforts, how do we know that that's a need? Like, what are the data behind it? And I am certainly not saying that those, conversations and that elevation of need from families isn't important. It certainly is. And it's a both and, right? Like, we want to take that information, hear what families tell us about what's working and not working. And we want to pull in some data of what do we know? And then asking ourselves, are we ready for change? Which it sounds like you all are in the throes of that now. And then from that, once we've identified the need, we want to establish the outcomes that we're trying to achieve. This is just an example. This is not an exhaustive list. Your outcomes would actually be tailored to the work that you're doing, but it could include things like a skilled workforce. Do we have a comprehensive service array? And are families together? And can they say, this was really helpful and we're better off because of whatever that piece is that they've accessed. And then when we take those two components and we're identifying the need and we're establishing our outcomes, then we want to really assess fit. Like, what are the things that we're proposing to add? Is the reform that we're undertaking, are the things that we're doing actually going to impact the problem that we've identified? Are they going to support the population that we've identified? And are we creating new experiences for families? Like, is access easier? Are they able to get what they need? And is it helpful? And so along that way, there's some things, that once we've kind of defined that diagonal line there, and our outer setting, of course, we know that there are financing, policy changes, there's certain population needs, maybe leadership, a system design. And then your inner setting, meaning that provider level. So we have our system level at the outer setting, our providers and organizations at the inner setting. Do we have the right provider types and the qualifications? Are there workforce development needs? Do we have quality and fidelity monitoring around the practices that we're trying to install? And then the pieces that bring all of this together are what implementation science coins as bridging factors, which are those needed partnerships. It could be with purveyors of the models that you're trying to install. It could be access to expert coaching and really trying to close the gap between policy and practice. And so is it, a university partnership? What are those things that are needed to kind of pull all of these pieces together? And then moving on from there, our step one, remember of our 5-step process here, our step one is using data to better understand those service array needs. And I think that cartoon is indicative of what happens all the time, is that we think, oh, this is a great idea. And we're still trying to figure out what that idea is going to address and what the problem is that goes with it. So, we like to have a little fun and all of that. But as we're looking at our data, we really want to understand the system as a whole. And so what is that data story? And as leadership, you're outlining available services that include medical necessity criteria, provider types, and determining which services can be accessed by what level of need and identified need of the family. And so this chart, I'm actually going to break it down. So I'm going to show you the right side and the left side just to blow it up a little bit so that everyone can see. So our first point of, and I see it says identifying your interruption points, which I'm going to define for you in just a minute. But that community placement or that community-based data story, and what are the entry points, or do different entry points, show varying levels of need, and do they result in various outcomes? And when we talk about entry points, we mean, where is it that families are accessing the system for the first time? And so our first data indicator would be determining whether youth from different systems, it could be somatic health or pediatricians' offices, child care settings, early school interventions, behavioral health, child welfare, juvenile justice, and so on. So do youth from different systems have higher levels of behavioral health need upon first entry? And then we want to break that down into two components. The first is through which system did they first access services, and what was the level of need upon first entry? And that's important because we need to know, where did all of this start? We want to determine where youth exit, where families exit from behavioral health services, what did they use and which systems were involved? And then there's also the flip side of that big graphic are the residential placement data story. And so does where youth start define where they end up? And so as part of this process, you really want to dig into your data, your Medicaid data, your utilization, your behavioral health data, your information from families, all of that, to identify from where and when youth enter residential interventions. And so where did the youth enter the system for the first time, and what did they access prior to that residential intervention? And was there any prior residential use? And then the second part of this component is identifying what happens when youth come home. What are the step-down interventions that are used, and are community-based options available when they return to the community? And so looking at this data is really going to help you start to address the gap between a family's current experience that may not have the best outcomes. They may not be able to access what they need. And so there's a lack of coordination and availability and so on. But we want to shift that. We're going to identify what they're currently experiencing and then establish what are the desired experience. What are families telling us would be helpful? And as a system, we want to make sure that it's coordinated, that there are care standards, that we can define a practice, we can monitor it, we can look at it, we can assess satisfaction and so on. And so as the SIAC committee and as your service array committee, it's how do we start to bridge that gap between what families are currently experiencing and what the desired experience would be. And there's some key components to that. The first is infrastructure. And so making sure that as part of that infrastructure, among other things, that there's a clear assessment and screening, that there's care planning and delivery is outcome-based, and that it's child and caregiver centered, that there are care standards around the practices that we're installing, that it's guided by best practice approaches, and that we're providing it at the right time and the right place. And of course, there's ongoing CQI, because we want to monitor if any of this is working, and we're routinely monitoring that, reviewing and reporting that out. And now I know you're tired of my voice a little bit, so now Denise is gonna jump in.
Thanks, Kim. So as Ivy gave you the introduction about care pathways, in addition to implementation science, we're talking about care pathways today. And we have on this slide the system of care concept graphic that we know you're all familiar with. So care pathway models provides a way to operationalize system of care concepts and move beyond that value base. So mapping pathways to care for families and youth provides systems leaders with that visual decision-making model that really sets forth, most importantly, the family and youth's experience in a system for a well-defined population and for a specific period of time. Kim, can you just go back for 1 minute?
Oh, I'm sorry.
So in alignment with the system of care philosophy or outer ring and overarching principles, when you're mapping care pathways, systems leaders in partnership with youth and families should identify and agree upon that problem or issue to be resolved. We're going to talk about that in a bit. Define the outcomes sought to be achieved, identify interruption points. Kim promised you we're going to get to that in a second. And interruption points, again, are those places in the pathway that system leaders need to intervene to move the marker and identify and address that identified problem. So when we're looking at new care pathways for families and youth, that's comprised of the services and supports in the middle of that bullseye diagram, right? That address that identified interruption points. And it's the infrastructure, so that middle ring needed for family and youth care pathways to be successful. So system leaders are working on that infrastructure, and we map those out in indicators to hold ourselves accountable and track systems progress. So let's go to the next slide. And this just gives you further definition of care pathways. So care pathways are first used in primary healthcare arena. For providing a mechanism for integrating evidence-based approaches into clinical practice. We are applying the concept of care pathways to translate best practice approaches to organizations and systems. What's our responsibility in making sure those care pathways are successful? They're used to enhance quality and consistency of a practice or initiative that supports improved outcomes and satisfaction of youth and families, while optimizing and leveraging cross-system resources. So again, that care pathway is that this visual decision-making model. For service array design, it supports the rebalancing of care between community-based options and residential settings. The work really focuses on families' experience based upon evidence-based approaches, enhancing quality across the continuum, and improving outcomes and satisfaction. So let's go to the next slide. So step 2 is to really turn to your family and youth leaders. And I'm really happy to see we have so many with us today. And wanting to understand what's their current experience. What does their current care pathway look like? Do those experiences align with what the data is telling us that Kim spoke about in step 1? And or does the family experience identify additional issues that need to be resolved by system leaders? We need to understand when and why and how often family care pathways are getting lost in the woods, maybe getting stuck in traffic, running off cliffs, or resulting in U-turns. We want to know the why. What's their experience? Let's look at the next slide. So when approaching care pathways mapping, strategic planning, there's 2 ways to approach the work. One is to support the installation of a selected program or practice or service as part of a good and modern system design, such as maybe wraparound or mobile response and stabilization or an evidence-based practice. We're going to look at towards the end at an example of using mobile response and stabilization. The other way to use care pathways is to identify a systemic problem. Lee and Ivy reference the report that's being circulated. It could be addressing custody relinquishment. It could be addressing out-of-state placements, use of EDs, children coming into juvenile justice for behavioral health needs. Those are the two ways of looking at it. Let's go. We're finally going to talk about interruption points. The next slide. So to operationalize system of care, we need to identify the interruption points. Those are those places or points in the care pathway, and use the data to understand them. Interruption points are really opportunities for good system design to use multiple, whether it is innovation or approaches or installation. Where are those opportunities where families are getting stuck, where the data is telling us our care pathway is not working, to fundamentally change the way we do business and move us closer to positive outcomes for youth? So again, there are opportunities for system leaders to change current pathways and or create new pathways. And Kim, I think you're up next.
I think so. Oh, there we go. So what you're seeing on the screen, I thought this was animated, but it's all here together. So it's a real oversimplification of a system. And so let's look at the gray boxes. Like, let's just focus on the little gray boxes and look at the kind of, I guess, trajectory or the flow of your service array and your system, and how families, begin to access those pieces. And so the first little gray box is around that early childhood population, pediatricians' offices, and so on. And then it moves into daycare, school concerns, your traditional outpatient services, maybe other specific system services. And then at some point, we sit back as a system and, things aren't really working, and there's a decision point that says, is it time to increase the intensity of support? And sometimes that's a yes. And if that's a yes, you'll see your little arrow go down to the next gray box where there might be some system involvement or system support. And then moving to your intensive and home support, your maybe hospitalization and so on. And then again, there's a decision point around ongoing complexity of need and so on. And at that top level, if we decide that no, there's not an increase in intensity of support, maybe they continue with traditional services. But you can see how that begins to create a cycle, if you will, of I actually had a family partner at one time talk about it as a blender, where families are just kind of flipping through the system and trying to get access to the things that they think might be helpful. And so what we want to think about in this oversimplification is, where do we want to interrupt a family's current experience and intervene so that their experience is different? That's an interruption point. And that's what the data is used for. That's why you're collecting all of those things, is because sometimes where we think we need to intervene is because that maybe it's a louder voice, it's more expensive, it's harder, like all of those things kind of play into our decisions. And that's why we need to pull in that data, because it could be that early prevention is where we need to intervene. And so now I'm looking at those dark blue arrows. But that early intervention point to interrupt, it could be that we do need specific service array additions that would allow us to meet needs that we have not met before. And then it could be that we need to coordinate with other systems around efforts and initiatives that are happening there, like the Family First Prevention Services Act, and insert some care coordination. It could be intensive care coordination needs and wraparound and so on. And so as we're identifying those interruption points, we have to also consider that the research could indicate that early identification and intervention are more impactful for a particular identified need. That are their cross-system service array considerations, meaning that, do families get involved with child welfare or juvenile justice because they can't get access to things that they need or things that would be helpful any other way? And so how do we then move those out of those system silos and into the service array as a whole so that families can access them without system intervention? Do we understand the behaviors that are placing youth and families at risk? Do we know where they're coming from? Do we know who they are? And as a system, do families have access to mobile response and stabilization? So those little trucks that you saw in the previous slide, and then here, is mobile response and stabilization available across the system? I mean, you want to talk about a huge impact and huge interruption points for systems, is that you could change a family's experience with that one piece. And then also not forgetting that it could be that you have a great service or support available for families, but that there's workforce development needs, that we really haven't hit a quality delivery of a particular thing. And we need to make sure that we're considering that and that we're supporting those best practice approaches.
So everything that Kim just spoke about with those interruption points, step 3 is really for each identified interruption point in your current design, using research, using data to evaluate strategies and/or models that are the best fit to support the development of desired or new care pathways. And it's important at this step, and that's why it's great to see such cross-system representation in today's meeting and for this work group as a whole, to consider which systems need to be included in the intervention design and implementation to receive the desired impact and results, right? This requires systems leaders to research and evaluate options, strategies, determine which are most likely to best disrupt the existing care pathway at the identified interruption points, as Kim just spoke about in the past 2 slides, resulting in those improved outcomes for populations you're trying to address. You already spoke about this. So slide 19 here is the service array. These are all examples of types of services and supports in a comprehensive service array. And the availability of the appropriate services and supports really sends a powerful message about the values and goals of your comprehensive continuum. Next slide, and it's back to you, Kim.
Thanks. And so I'm going to show you some examples of how states have traditionally organized themselves and how sometimes families don't experience the system in the way that is probably the most helpful, because sometimes we create buckets in systems, right, where we have an identified or an assessed level of need, and we've determined that there's a low intensity or a prevention level, and we've stacked some services in that bucket. And then in the next bucket, you know, if that doesn't work, then we're like, wait a minute, maybe needs exceed this, and there's a medium intensity or some sort of enhanced intensity of need. And then we create a bucket for that. And so if a family happens to assess for that, then here's, you know, it kind of opens the gate, if you will, to access other things. And then we know if there's a high intensity of need, that we've kind of restricted use of some of those things for those populations. And we actually want to move away from that. We want to move away from these funnels and these buckets. And we would like the provider array or the service array to really look at families as a whole and recognize that families may need to pull from all of those historic buckets that systems have created. And they may need something out of a high intensity or middle intensity or low intensity, and that the person who needs it could be a different member of the family outside of the identified youth or the youth that's being referred. And so that's what you'll see in our lovely tree, is a couple of caregivers, some youth and some siblings, and there's all different needs. And so how is a system, do we create infrastructure, that middle ring in your bullseye? How do we create the infrastructure so that this can happen, where families are accessing what they need, no matter the level of intensity of need?
And so this table, I'm sure your service array committee already has something similar in the works. If not, this is our gift to you. In addition to thinking about your service array in trees, we recommend you're also looking at focused on total population, right? And so which services are going from prevention, early intervention to intensive services, and which play a role in different parts of your continuum. Next slide. This is the May 2013 SAMHSA and Center for Medicare and Medicaid Services joint bulletin. This was the holy grail, the Bible. We were all so excited in the system of care and children and family world to see this come out and have SAMHSA and CMS agree on the essential services for a continuum of care for children and families. So I'm not going to read this. I recommend you paper the walls with this. It's helping states across the country really leverage both SAMHSA and Medicaid dollars to put in some essential services into your continuum, including peer support. Go ahead, Kim.
And so I want to show you some specifics related to some of the graphics that you've seen and so on, and just another way to think about care pathways at these different levels. And so at the youth and family level, as a system, there's some sort of access point. And, you know, have we considered that? Is it easy for families to do? Or to find out about? Is, you know, the eligibility intake processes, there are model elements with the practice that they're trying to access, fidelity and quality checks, and of course outcomes. Again, was helpful? And in that, though, that will absolutely not work if we don't address the other elements or the other levels in the care pathway. And so that first level where families access or can impact the success of that family and youth pathway is the programmatic pathway. And so that is marketing, implementation, the procedures for accessing it. Do we have quality staffing? Are we collecting data? Do we have access to expert coaching? And are we actually finding out if things got better? And then the other level at that system pathway is the system designed for both the youth and family to actualize the supports that they need and that they want? And is the system designed supportive of the organizations and the providers to deliver it in the manner that we expect? And so the system has to take some ownership in all of this kind of working, right, by creating regulation, policies, procedures, you know, rates, making sure that they can sustain themselves, that there are practice expectations, that there's oversight and ongoing CQI, and so on. And then we have one more visual that Denise is going to talk to you about.
So as we promised, here's just a care pathway for mobile response and stabilization. Again, this is where it's a good and modern system design where it's installation of mobile response and stabilization. And again, as Kim indicated in the prior, it's really important. We could have the best installation of service. You could have high fidelity approach in how you're installing that, but without considerations and attention to that program and systems pathway, you're not going to achieve the outcomes because they don't have that hospitable environment. They don't have the system and programmatic approach needed in order for that care pathway or the installation of that service to be successful. So again, this is just an example of mobile response and stabilization, which we'd love to talk to you more about in another opportunity. Let's go to the next slide. This all comes down to step 4, which is using, we have the system reform support instrument, or you could use another tool that helps you select indicators to hold ourselves accountable and determine those system considerations. What needs to happen at the policy, management, practice, and community levels in order for that care pathway, the installation of that or innovation to be successful, right? So what we want to do, and this may look familiar to you as well, it's organized by Sheila Pyre's Systemic Care Primer at the policy management practice level. So at the policy and management levels, we're looking at the development of care pathways can lead to increased coordination, as Kim showed you in this slide a couple prior, across systems, that shared decision-making, clearly established standards across the system, ability to leverage and optimize those cross-systems resources representing all of the membership in the SIAC. At the community and practice levels, it's the use of care pathways can be used to enhance the quality or consistency of the practice or the initiative, that workforce piece, increase satisfaction, improve outcomes. Let's look at the next slide. This is just a sample of the system reform support instrument so that you can see that there are essential indicators to track at pre-implementation, implementation, and sustainability. And again, we're looking at the policy, management, practice, and community. And this is just as shows you, we're looking from anything from leadership, as Kim mentioned, financing, rates, structure, making sure that we have the appropriate population for the installation of the service that we're looking at, and et cetera. So again, just an example. And it's back to you, Kim.
And so along the way, people, I think, are probably familiar with Plan, Do, Study, Act, you know, kind of evaluation or CQI opportunities. What I think we need to add, though, is that as a system, it's never a one and done, and we need to stay checked in along the way. And so it's really a combination of those Plan, Do, Study, Act with a Plan, Do, Check Act. And the difference is that in the Plan, Do, Check Act, we're checking in and we're saying, hey, how's this going? We're looking at data fairly frequently to see if we're impacting the family's experience. Are they able to get to what they need to get to? What are the barriers and challenges? What information do we need to make changes? How do we address those, and so on? And so that's your checking in. And then, of course, we want to study, and your study is the kind of long-term outcomes that we're hoping to achieve. Did it matter what we did? Did it even make a difference? And we need both of those for this to work. And so our step 5 becomes continually evaluating the implementation cycle and the care pathways, you know, to achieve these great outcomes that we hope you know, can be achieved. And I'm not going to read all of these to you, and I'm sure you're very familiar with these outcomes, but they're really important, and the quality assurance needs to be really routine and overt. And it's important that the system balance between community-based options and those more restrictive options, residential interventions, and so on, and that families are reporting that they can access what they need, that they're satisfied with what they're getting, and that they're better off because they got it. And how are we continually checking in around those things in addition to all of that? And then we can't forget to check ourselves sometimes. Like, we have to look at our systems and the things that we've put in place that impact how a family accesses and experiences the system. And so, are we reviewing the referrals and eligibility criteria? Are we partnering with families at the right time and place? Who's getting left out? Where are the gaps? What's going on with our workforce, and do they have the skill to be able to deliver what we hope? Are we checking in around policies and procedures as funding and financing streams are changing, as new initiatives are coming in? How are we continually revisiting those pieces? And just making sure that we're carrying that forward into any future reform or efforts that we might be undertaking. Because at the end of the day, we're here for the families, and that's why we're all doing this work. And then, of course, there's some references. I'm going to stop sharing so that we can answer any questions that you might have. And these slides will be available to you following the meeting as well. So thank you all so much for letting us talk a lot today.
All right, thank you, Kim and Denise. Does anyone have questions?
This is Leslie. I'd just like to say I so much enjoyed this presentation. I've been texting back and forth with my staff. I appreciate you all providing this today. So thank you very much.
Thank you.
Thank you.
And I'm sorry, I had to step away for a minute, but is this going to be something, are we going to get a copy of this?
Yes.
Yes. Yeah.
Yeah, great. I've much enjoyed it too.
Yes, thank you.
I think that I loved it. I think that it was dense. And so I'm looking forward. I don't even know that I'm sure I have questions, but I really just want to take it back and digest it. I wrote some things down that I just want to go back and look through, but I loved it. I think it's very timely for us, or maybe I can just speak for myself. I think it's very timely for me. And I appreciate the examples, as well as, you talked about the process, but then you're like, here's some examples, and that is so helpful for me as well. So thank you.
All right, thank you.
Denise and Kim, this is Tina. I have a real, I guess, practical question. Because I staff the service array committee, so I'm trying to think about the practicality and the logistics of using this framework and applying it, because I think it's exactly what that standing committee has needed to guide our work. So in step 2, you talked about, assessing what youth and families currently experience so that you can then identify those interruption points. So from a real practical standpoint how do you go about collecting that type of information? What are some ways that other states have gone about determining, collecting that data and determining what the interruption points are? Do they do surveys? Do they do focus groups? Do they, what's that methodology look like?
I would say the one that's used most often and, gathers the best information is probably a focus group kind of approach. And what we've also found is that, states are very different. I mean, you have rural settings and urban settings, and making sure that you're really checking in around, the geography of the state and so on. But you're also going to begin to reach a point of saturation where the stories, the information is very similar. And so I don't know that it's a huge lift. It's not like, there has to be 50 focus group sessions around the state, but some really strategic, targeted, regional, kind of information gathering sessions, I think have been most helpful, and the best information has been provided. And I think Dr. Brenzel, you had unmuted yourself a couple of times, so I didn't want to miss that. Denise, did you want to add anything around that?
Let's let Dr. Brenzel.
Okay.
No, I mean, I just wanted to thank you, and I had the opportunity to see this earlier, and I think as has been mentioned, it's very, very timely in terms of the service array group. And for us, I do think, that issue of interruption points for me seems to be the place to start, because we've defined what an ideal system looks like, but I think bringing in that family and direct consumer experience as to what they perceive as the interruption points. But then very quickly moving to, what is the data? What are the policy issues around that? What is it universal? Is it regional? Is it, I'm really looking forward to being able to use this tool to move us beyond sort of defining and creating infographics to really looking at what are those interruption points, and helping us organize, because I think as a state, we have so much happening right now, many work groups across all of our different organizations. And how do we pull them all together to address the interruption points, as opposed to each working separately on our own system interruption points? So thank you very much. Looking forward to how we can integrate this into our going forward.
Thank you. And to your point, Dr. Brenzel, you could really start step 1 and step 2 at the same time. So let's start pulling data, especially your separate agency data, seeing what story they tell. In addition to the family and youth experience is absolutely important. And then we use data at the end too. So if you use with our tool with the SRSI, each indicator, you rate yourself. Are you not at a starting place and it's a 0? If you started, it's a 1, it's a 2 if you're fully there. And then from there, we look at the indicators. You prioritize which ones you need to work on first. You move that into an action planning. And it's really a way for us to hold ourselves accountable as leaders across systems to provide, again, I keep using hospitable environment in order for those services to be effective for our families.
I saw comments in the chat, so thank you all very much. You're very kind. I'm glad it was helpful. I didn't see any questions though.
Kelly's trying to speak.
I'm sorry. I just wanted to say that, and this is just some input, that when you start to do these focus groups, I know you talked about, the different areas and needing to take those things into consideration. So something that I would definitely advise is just being extra intentional about making sure that it is, that the questions are worded in a way that everyone can understand. So, for instance, maybe like an easy reader, format. So I just wanted to offer that input there.
Absolutely. Absolutely. And we're happy to help with that too, if you all have questions around that or things like that. So.
Yeah, thank you, Kim. That was actually when Kelly was saying that, I was thinking you all probably have some, guidance you could give us on how to design those questions in a way that are so that we get accurate information back from folks.
I don't see any other questions. So I do want to thank you all again. And if questions come up after we leave, certainly reach out and we're happy to support in any way that we can.
Great.
So thank you again.
Thank you.
Thank you so much again for being here and presenting.
And week.
It's a great way to start our day. Take care.
Thank
Bye-bye.
you.